Most MFM practices, I would have to say, require some experience, but a lot of sonographers ask, like, well, how do we get there, right? How do we get to that level?
Sonography is a diverse field with many specialties, and one that is increasingly in demand is maternal fetal medicine. Today, we're joined by Mishella Perez, who will be telling us about the critical need for more MFM sonographers. Mishella is the clinical ultrasound educator specializing in high-risk obstetrics and fetal echo at Scripps Health in California. Mishella has over 16 years of experience and is a member of various societies, including the Society of Maternal Fetal Medicine, the International Society of Ultrasound and Obstetrics and Gynecology, the STMS, and the AIUM, where she is actually currently serving as vice chair for the Obstetric Community of Practice. So she has quite the resume and is the ideal person to be speaking on this topic. Thank you for being here, Mishella.
Thank you, Emmanuel, for having me.
So I know that the stereotype to the general public, at least, is a sonographer. That's the person that's scanning, mom when she's getting those images, the family's excited, and it's, just a happy moment. That's what we see a lot, in media. But there's a whole lot more to it than that. And this specialty, MFM, is really important, and is actually in settings that are more high risk, right? So I think you'd definitely be able to explain it better than I could. So for those who maybe aren't as familiar with this, even other sonographers in other specialties, could you give us a breakdown of the special role that MFM sonographers play in healthcare?
Absolutely, Emmanuel. So as you mentioned, MFM sonographers play such a critical role in healthcare, particularly in obstetrics. Maternal fetal medicine, basically, so what is MFM? A lot of people ask that off the bat. It is a subspecialty of obstetrics that focuses on managing high-risk pregnancies and monitoring the health of both mom and her unborn baby. MFM sonographers have such a unique and advanced skill set to perform specialized studies, such as the first trimester detailed and also second trimester detailed anatomy scans, Dopplers, in which we were looking at specific vessels within the fetus, also assisting with ultrasound guided invasive procedures such as amniocentesis or chorionic villus sampling, and fetal echocardiography, in which we are evaluating the structure and the function of the heart, just to name a few. Now, that's a lot more I could go into. We also, as MFM sonographers, we work closely with MFM specialists, obstetricians, fetal cardiologists, radiologists, and genetic counselors. As you can see, it's a very multi-collaborative learning and education process. So overall, it's a specialized field, and we contribute so much to the early detection of abnormalities and assessment of high-risk pregnancies, ensuring the best possible outcomes for both mom and her unborn baby.
Yeah, that's great. I mean, extremely, extremely important. Could you just tell us a little, though, about the difference between OB? Like, if I say I'm an OB sonographer, I'm an MFM sonographer, can you explain to the audience a little bit about like that detail?
Yes, thank you so much, Emmanuel. That is an excellent question. So an OB-GYN sonographer performs the standard obstetric ultrasound for the general population, and they are in all clinical settings. So what I mean by that, they're in community health, they're in radiology, private practices, even clinics. But let me go ahead and just provide you a clinical example just for you to have a better understanding of what the difference is between an OB-GYN and MFM sonographer. So an OB-GYN sonographer is known to measure the fetal biometry to produce an estimated fetal weight. They also measure fluid-filled structures within the fetal brain. As they are scanning, they notice that there is lateral ventriculomegaly, which is an abnormal finding. Now, what happens next? The patient gets sent to maternal fetal medicine. Now, what does an MFM sonographer do in this type of clinical situation? The MFM sonographer does a deep dive into the fetal brain. They perform advanced imaging techniques such as 3D multiplanar to ensure that there is the presence of a cavum septi pellucidity, a vermis. They also assess if there's the presence of presence of the pericallosal arteries, All of these components obviously will rule out abnormalities such as a genesis of corpus callosum, aqueductal stenosis, just to name a few. But another clinical example is, the sonographers, OB-GYN sonographers, they are known to also evaluate the fetal heart. As they are scanning, they also notice some left and right-sided heart discrepancy. Now, Emmanuel, what happens next? They get sent to maternal fetal medicine. And as an MFM sonographer, we sometimes do what we call a fetal echocardiography, in which we evaluate the structures of the heart. We take a look at the chambers, take a look at the peak velocities of the heart to ensure to rule out any abnormalities such as aortic coarctation or hypoplastic left heart. So as you could see, the differences the skill set between an OB-GYN and an MFM sonographer, it can vary. MFM sonographers have the critical thinking processes to help formulate the diagnosis with the MFM team and optimize outcomes for high-risk pregnancy.
So tell us a little bit about yourself. I mean, you're involved in several societies. You've been a sonographer for a long time. What motivated you to specialize in MFM specifically?
So what motivated me mainly was just the advanced imaging technology that's present in the field of obstetrics. As you know, that with ultrasound imaging, as they have advanced, so does obstetric imaging. So now we're pushing the envelope to be able to screen at an early gestational age. So I found that very fascinating. I also think what motivates me is the potential to impact the patient outcomes. So that is where I feel like our field, is very specialized in really improving those outcomes for both mom and baby.
Yeah, I mean, it's an extremely valuable role. I mean, it's a situation where, first of all, the patient themselves is probably so worried, already they probably don't want to be in that situation, but such a valuable role to have that expertise to then find, diagnose, right? And then also be able to find those things that can improve patient outcomes. Without that imaging, I mean, you're kind of blind to that, right? To a certain extent. Did you start in OB? Well, when you started as a sonographer, what did you start in?
After graduation, I started out in radiology performing general sonography. So this obviously encompasses an array of studies such as vascular, abdomen and small parts, and even some obstetrics. During that time, I developed a strong interest for obstetrics, especially the heart, which I love, the fetal heart, and was fortunate to get trained into maternal fetal medicine. And here I am today.
Interesting to see the pathway, right? I mean, it's such a, like we said in the beginning, it's a diverse field. There's a lot of opportunities as a sonographer to grow. It's something I hear often from other sonographers. You start in one area, you go discovering another area, and, the passion kind of builds there. There is a need for more MFM sonographers though, right? A big need. And so from your point of view as an ultrasound educator, what do you think are some of the main obstacles that stand in the way of more sonographers saying, hey, I want to be an MFM sonographer, I want to specialize in this? Why do we have such a shortage, even though I know that we have a shortage in general of sonographers, right? But in this area specifically, what are some obstacles that you observed?
So one of the main obstacles that I've recognized is specialized training opportunities, right? So MFM sonographers, again, like I mentioned, they require such a unique skill and education specific to high-risk obstetrics. That in itself is also lacking in your, typical diagnostic medical sonographer programs. So most MFM practices, I would have to say, require some experience, but a lot of sonographers ask, like, well, how do we get there, right? How do we get to that level? So you always have that gap. So I feel that organizations and institutions, they really have to invest that time for training and education to sonographers with even the little or no experience to become proficient in MFM. So I feel like that's one of the biggest barriers, is just providing that opportunity for training, specialized training.
So would you say that on-the-job training is important? Like, is that a potential pathway for us to get more MFM sonographers?
Yes. On-the-job training is currently the only existing pathway for sonographers to train into MFM. At this moment, there is no formal certification or educational pathway for that route. At Scripps, we developed what we called the Perinatology Transition Sonographer Program back in 2021. We have completed about 3 cohorts. And in order to address that gap, we are training sonographers who have little to no experience in maternal fetal medicine. The training program takes about 6 to 12 months. And this is what we've learned in order to train an MFM sonographer or sonographer with no MFM experience into MFM proficiently.
But what new initiatives are there to facilitate that MFM sonography education, such as a certification or a designation? Could you tell us a little more about that?
Yes, so that is the most exciting part. So of course, national organizations, they've been listening to the needs of providers and also its members. So we have a committee which is initiated by the Society of Maternal Fetal Medicine, and including all invested stakeholders, namely the American Institute of Ultrasound and Medicine. You have also ARDMS, SDMS, and Intellios. So we're committed to constructing a well-considered pathway for the MFM sonography certification and the MFM Advanced Practice Sonographer, which functions as a mid-level provider, similar to a physician assistant. So these 2 designations will help MFMs and appropriately recognize the additional efforts required by sonographers who are or who choose obstetrics. So as you can see, that is pretty much a career ladder for sonographers that we are trying to build, which I think is amazing.
It is amazing. I mean, it's a clear pathway, right? Which is what you're saying. We need something more formalized, more recognized on an official level. And I'm sure that that's going to contribute to addressing that shortage more effectively on a national scale, for sure.
Absolutely.
Yeah. Now, talking a little bit about the societies, especially for sonographers who are newer, or maybe they've been doing sonography for a while, whether it's MFM or another specialty, but they're not as involved. You're very involved in various societies. What would you tell them are the key benefits to being this active as a clinician? Why are you so involved, and what have been the benefits that you've reaped from it?
Oh, a lot of benefits. And I feel that I owe it to the societies. I wouldn't be where I'm at if it wasn't for them, for the support, for my learning process. So certainly professional development is very big to me. This is where you have access to ongoing education, workshops, conferences. This also helps sonographers. And I'm not just talking obstetric sonographers, I'm talking variety of specialties, which keeps you updated in the latest advancements and best practices. And so that's why, Emmanuel, with EDM, it's amazing what you guys do, because you kind of share that too as well. So being a part of that, I feel like you spread the word. Another thing is, with being involved in the societies, you also provide advocacy, right? You actually, you try to bring awareness to the profession and also bring change to the profession, elevating the profession. So that's something that's big to me. And I also think networking opportunities. I feel that I am not able to get connected with anyone unless I really talk to them in person, share with them my plans, or you also find mentorship opportunities. So I feel like there's so much benefits. I know, especially post-COVID, everyone wants to stay home, do everything remotely, but this is something that we're trying to bring back again, where, to really, get connected with people when you attend these conferences, especially these in-person events.
Exactly. I mean, those meetings are invaluable. Like you say, I mean, after COVID, it got really hard during COVID. After we're still trying to recover, but having those meetings, those conferences in person are of such value. Getting to build those relationships. This is something I've heard from other sonographers, other imaging managers who've also been very involved, have gone to things like the ASC Leadership Academy, for example, which is that I know every organization has different initiatives like that, but those mentorship initiatives and that growth opportunities really are of such value. as a clinician. And I've seen that, and what you say, I think, will resonate with a lot of other sonographers. So if they're not involved, I mean, I really think that what you just said should be motivation enough to get more involved there. Well, Mishella, thank you so much again. I mean, I think this topic is really important. I know there's probably a lot more to be said on it. If people want to learn more about just MFM, where can they go? What would be the best resource, in your opinion, for them to look into that?
A lot of interest for MFM. I would say, start AIUM, American Institute of Ultrasound and Medicine, has a lot of great resources that are focused on MFM. Obviously, Society of Maternal Fetal Medicine has also a lot of, educational and as well as in-person events. I mean, that is mainly our society as well.
Right.
So I would say that's pretty much it. I feel that MFM is a specialized field that needs to bring awareness, especially for
Yes.
sonographers who are interested. And I thank EDM for bringing that to the table and me discussing it. But yes, there's so much growth and development in the background, and I really
Absolutely.
look forward to the next several years of what will come of this.
Absolutely. Well, thank you again. We appreciate having you on and for you being such a voice for this specialty.
Thank you so much, Emmanuel.